Now, the bottom line, as even Senate Republicans know, is that they are never going to hit the 1.5 trillion number without taking a substantial axe to Medicaid. And given he's leading the charge, here's some context about Mike Johnson you should all know. Almost 40% of his district is on Medicaid, his congressional district, the people who elected him. That's nearly 290,000 people, according to data from KFF Health News. In fact, a major rural hospital in his district remains open thanks in large part to Medicaid. And when KFF Health News spoke with 24 Medicaid enrollees in his district, most of them said they had no idea Speaker Johnson's budget could put that very coverage at risk. So here's a little idea for Democrats before your next town halls. Now's probably a very good time to educate your voters in your neighboring Republican districts about what those Medicaid cuts could mean. Because what's on the chopping block isn't waste or fraud, obviously not. It's hospitals, it's nursing homes, and it's keeping people care within reach for so many people. Congresswoman Melanie Stansbury is the ranking member on the House DOJ subcommittee, and Jen Palmieri is the former White House communications director under President Obama, and both of them join me now. Okay, Melanie, Congresswoman, I want to start with comments from Speaker Mike Johnson this morning on Medicaid cuts. And get your thoughts, because this is just, the claims they're making are just, they don't pass the smell test, but let's play this and then we'll talk about it.
We have to root out fraud, waste, and abuse. We have to eliminate people on, for example, on Medicaid who are not actually eligible to be there. Able-bodied workers, for example, young men who should never be on the program at all. Now,
I just walked through some of my issues with Mike Johnson, of all the people making that argument. But I think it's so important for people to understand what's actually going to happen here, potentially, to Medicaid. So what does that tell you about where Republicans are heading on this? What can you tell people watching?
Well, first of all, Mike Johnson is completely blowing smoke right now, because the budget framework that they passed a couple of days ago is very clear. It will cut $880 billion from the committee of jurisdiction that oversees the healthcare of Americans. This is $880 billion in cuts to senior living facilities, to healthcare facilities. And whether you're on Medicaid or not, you should care about what's happening, because hospitals, healthcare clinics, I live in New Mexico. It's already difficult to get access to specialty healthcare here in New Mexico. A major cut to Medicaid will decimate our healthcare system for everybody, because our hospitals and everyone depends on it. But here's the thing, they're just lying. And I think, we've all become accustomed to Donald Trump and his modus operandus of lying to the American people, and Mike Johnson is one of his closest allies. And this week, as the Republicans were melting down on the House floor, basically he and the leader of the Republicans in the Senate had to promise the fiscal conservatives in the House that they would cut Medicaid and cut spending by $1.5 trillion, or else they wouldn't have voted for it. So it's very clear it's in the framework. And by the way, Republicans actually leaked their own budget document that showed all of the Medicaid programs that they plan to cut. So it's a complete lie.
The math just doesn't math sometimes with what Mike Johnson is saying. That's not a good messaging tactic. Okay, Jen Palmieri, you and I have probably done a combined 1 zillion campaigns. The House is on recess this week. Right. This is a time where people can go out to their districts, or members who are not vulnerable can go to Republican districts. They can help people running. What should the message be in a clear and concise way on Medicaid cuts that you'd love to see Democrats doing this week?
I think that the benefit that Democrats have now, even though it's been so damaging to the economy, is people's attention, right? Because of tariffs, because of the stock market crashing, because people worry about the 401ks. I think that whereas when Democrats have expressed concern about threats to Medicaid or other programs before, it might not have seemed real. I think now people understand this is a very different kind of administration, and Republicans, members of Congress, are propping up this administration. So you could say I would go back from the start, actually, Jen. I mean, as you did just now, to remind us about what Musk actually promised with DOJ and what's actually happening. Donald Trump said he was going to lower prices on day one. Okay, and look at where we are now with the economy. Look at your 401k. See how that is doing. People understand that there is no strategy with tariffs, and now they are coming for your Medicaid because all they want to do is deliver tax cuts for wealthy people. And you don't just make that about Trump. You make that about the Republican members of Congress that are, because let's do this in stages. They are the ones that are going to be on the ballot in less than 2 years. And to make them own it. And also, I think that there's a long way to go in the budget process from just passing the budget resolution to actually delivering on Medicaid cuts and actually passing these big tax cuts. And there is a very decent chance that Johnson will not be able to get the votes to do that and actually stop a bad thing from happening, not just campaign on it. So that should be the goal.
That's a pretty good goal. I hope everybody's listening. Congresswoman, you are an incredibly effective messenger. You do social media videos. You're great on TV. I was so looking forward to having you on today. Probably why I called you Melanie, not Congresswoman at first. I feel like I know you. But I wanted to ask you about another issue that you talked about, too, which is Social Security, because there's also a cause for concern around Social Security right now. And I know there's a plan for Democrats to go out and talk about this. Wired is reporting that the Social Security Administration plans to move all public communications to X, Twitter, whatever you want to call it. A platform, by the way, only 9% of seniors say they've ever used in their life, while also slashing regional office staff by 90%. How are you thinking about talking about the real world impact of that on American seniors?
Well, I'm going to come to that in just a second, but I want to say, first of all, that the announcement that Musk is going to move communications to X should not only be raising alarms for our communities that they're not going to be able to access information, but it is quintessential grift. Why on earth does Elon Musk want to move eyeballs to his own social media platform? It's because he wants to make money off of it. And that's exactly what the Trump administration is all about. And that is part of why Elon Musk's receipts don't add up, because this entire exercise has not been about rooting out waste, fraud, and abuse. It's been about privatizing the federal government, dismantling agencies they don't agree with, and then giving themselves private contracts and privatizing public services. So, part of what Elon Musk has done inside the Social Security Administration is they've hacked your data. What are they doing with that data? They say they're using it to study the system. I don't think so. I think Elon Musk, who just signed a merger between his AI company and Twitter, is planning to use that data for his own financial purposes, just like he is with Treasury data and IRS data. He has helped to execute the firing of thousands of IRS employees. He's now talking about moving communications for Social Security to his platform. He's talking about closing offices across the country. We have a Social Security office here in my district. And in fact, I'm planning to go down there tomorrow and meet with both the employees and the customers. And it's already difficult.